Thanks, Matt. I appreciate it. It's so nice to know that people are really enjoy looking at these on YouTube. I'm really happy. And, it's interesting because I think there's increasing awareness, little by little, of cannabis. And I've just read recently that the population, the demographic that is using cannabis the most is the elderly these days. So uh, it's, so it makes this very relevant. And anyway, we'll get started. There's so much to talk about. And I'm trying to like really fine tune this in terms of, but I think what I wanted to do to start with, which I've done in the past, is I think it's really important to know about the history of cannabis. So if you could do the next slide, Lauren. We have, from what I can see, and I've been doing this now for like 9 years, I think we have evolved with the plant. Um, we, every vertebrate animal has an endocannabinoid system. And I think that, and the fact that we make our own cannabis in our brain and our body, I think really goes along to show that it's just a really critical system in the bodies. And I think the fact that, even much more primitive animals than us, you have endocannabinoids, make their own endocannabinoids, I think is really fascinating. Um, but I won't belabor it. It's just, something that has sort of interested me for quite a while. And this, again, here, this is just to see that there really have been references to cannabis for 5 to 10,000 years. Certainly in the Chinese literature, the first pharmacopoeia in China talks about cannabis. So it's been around forever. I always mention Carl Sagan, who I'm sure people know. He believed that cannabis brought us from hunter-gatherers to civilized agrarian societies because, and I'll show in a couple of slides, all of the possible benefits and products, not just the medicinal, that cannabis provides, you really had to be in one place. You had to be able to plant it and cultivate the plant and then harvest it. And so will we ever know if that's true? I don't know, but I think it's, again, it's interesting speculation. All right, we can go on. The other thing that I think is very interesting and people should be aware of is that this cannabis was part of the US pharmacopoeia. In other words, it was accepted, excuse me, as a legitimate compound um, from the 1850s until 1937. So it was around. Everybody used, not everybody used it, but it was very well, it was used, it was appreciated. And then there was a whole political thing that happened. Um, Again, I think it's just important to know because it set us in the path that we are on now, that we're trying to pull ourselves out of. Um, the DuPont was making nylon. They were felt threatened because hemp rope was much more efficient, cheaper to make, et cetera. William Randolph Hearst, who had vast tracts of forests that he wanted to use for his newspaper industry, again, hemp pulp was much more efficient to be used for producing paper. And then this was at the time that the Bureau of Narcotics, the Federal Bureau of Narcotics, was put into being. Harry Anslinger, who was a relative of the DuPonts, was made the head of it. They started with Reefer Madness, all these movies. I mean, it's really terrible what happened, and it really just put things on hold for many, many years until 1970 when Richard Nixon decided that he was going to make a decision about what to do. Should he legalize it or not? He decided not to legalize it, and he made it a Schedule I narcotic. And the other drugs that are Schedule I narcotics, heroin, quaaludes, Schedule I narcotics have no medicinal benefit and a high potential for abuse. And so I think we can move on to the next. And that was really where things stayed. Obviously, a lot of people were using it, but the people of color, so many people were put in jail for using cannabis. And I think that was one of the things that Nixon wanted to do. He wanted to get the troublemakers out of the way. And now, again, we're dealing with the fallout from that. In New York State, a lot of the people who are being given licenses to have recreational cannabis dispensaries are legacy people who have been in prison. I was just at a talk last night, a podcast actually, with two of them. One guy was in prison for 3 years for weed. Anyway, so we're trying, and New York State is trying in their own way to rectify that. The plant has so many different active components. It has all of the cannabinoids, and I'll show what really the similarities are with the cannabinoids. Also terpenes, and I'm sure people who have walked down the street and smelled somebody smoking weed, or common occurrence, the smells are the terpenes. And the terpenes actually give a lot of benefits as well. And there's a lot of work that's just being started now looking at how to combine terpenes and cannabinoids. And we lost our slideshow.
Well, while we wait for Lauren to get back, I'll just make a comment, Dr. Weinberg. I guess marijuana would not have been made illegal unless it was present enough for them to bother to do that. So
Yes, no, absolutely. And they thought that they could just bring it underground, but it's just too ubiquitous. And I just had a blog called Reefer Madness, and I'm about to post another one on Psychology Today. I don't know if you knew that I had this blog.
no,
But in it, I talked about the fact that I have a patient who's from South Carolina, and when she was growing up, her aunts and her mother would go into the field and harvest something, and they'd cook it for days, and they called it rabbit stew. And it was only later that she realized, oh, this was cannabis growing wild in the fields of South Carolina, and they used it for medicinal, spiritual, all kinds of purposes.
sure.
So, yeah, I mean, people could not put it down,
Yeah,
So,
that's a
um,
great story. Maybe you can put the blog name, or have Lauren put the blog name in the chat later so people can take a look at that.
yeah, no, I'd love to have people look at it. I'm really enjoying it. Okay, oh, here we go. Okay, so now, Lauren, we can go on to the next one. Sorry about this. I think that the weather in Florida, Lauren, is problematic. Anyway, here are the two major cannabinoids. And when in the plant, when someone is given a medical marijuana or cannabis certification and they go to a dispensary, they are getting CBD and THC in different amounts and different ratios. And I can talk more about that in a moment, but that's really how we determine what will work best for everybody. So THC has great pain relieving properties. It's good for inflammation. It's also good for anxiety. It helps appetite. I have a lot of patients, especially, and this is in the elderly, but not necessarily just there, who are getting chemotherapy, who have nausea, vomiting, don't have a good appetite. Cannabis is very good for that. Think of the munchies. Um, and then it also is very good for muscle spasticity. And I always point this out to patients because I think, and the majority of the patients that I'm seeing have chronic pain. And I've come to realize over the years that when you have chronic pain, you are holding yourself in very specific ways to minimize that pain. But what winds up happening is that you get a lot of muscle tightness as part of that, and that feeds into the pain that you're having. So THC can be very helpful at alleviating that. Um, okay, now we can go on to the next. So here's CBD, and I think everybody knows about CBD. Everybody can go to their local bodega or wherever, the gas station and get CBD. The problem is, and I think people really need to know this, it's not tested. And that's why I'm very, for a number of reasons, I'm very enthusiastic about the medical program because I know that every batch is tested. Um, Cannabis and hemp, which are basically brother and sister, are super accumulators. That means that they draw up all kinds of stuff from the soil. In fact, um, hemp was put down in Chernobyl after the disaster to draw up radioactivity. But the practical point of that is that if you're getting weed on the street or even at, any of the million illegal stores that are all around the state, you have no idea what you're getting. And it could have heavy metals, pesticides, bacteria. So again, having the knowing that you're going into a dispensary where everything has been tested, is very reassuring for me. Um, so CBD is a great anti-inflammatory. Um, I have a lot of patients with autoimmune disease where they will take a high CBD product and it really, really helps keep that inflammation down. Um, Interestingly, and I'll talk a little bit about more about this later, but it's also an anxiolytic. It's very good for anxiety. And we're seeing a lot of that in our elderly, especially the demented patients, where CBD can really, really help. It's also, I don't know if you've ever seen, but it's very helpful for seizures. There was a girl named Charlotte, they made a company, Charlotte's Web. She had one of the it's a Dravet syndrome, which is a genetic illness where kids can have up to 100 seizures a day, and they are put on a variety of meds, none of which really work. They also put them down, they knock them down, they lead to developmental delays, and CBD can really, really be helpful. There's Sanjay Gupta has a great three-part series. It's a little bit old, but I think it's still relevant. And I think he shows Charlotte or another kid who is having these seizures. The parents give high CBD drops under the tongue, and the seizures will stop. So it's really remarkable. Also has analgesic properties. Okay, we can move on. This is what the plant looks like. I'm sure everybody's seen it. And again, you could look at this, you could smell this. This could be hemp or cannabis. They are really identical. Um, but again, you can see all of the different properties that the plant provides. This has been around. Pliny the Elder in Greece in 100 AD, I think, talked about the roots being used for joint inflammation. I've seen beautiful homes that are built with hemp stems, very modern, ergonomic, etc. So it's being used for that. Also, as I had mentioned, obviously for rope, leaves for juicing and paper. And I think I like the fact that the the Declaration of Independence was written on hemp parchment. So it's been around forever. And then we look at the seeds. They have all these different uses. And finally, the flowers. And certainly they have medicinal qualities. They also have spiritual qualities. And I think it's important to know that they can give you pleasure. A lot of patients who I have who have a lot of pain will say, you know, it helps with the pain, but it also, I don't care as much that I have this pain. And I just have to mention one other thing. I have a patient, or I had a patient, a Hasidic Jew, who had very bad Crohn's disease. And a couple of months into him using cannabis, we were doing a follow-up visit, and he said, Dr. Weinberg, does THC give you wisdom? And I thought, wow, that's an amazing question. What do you mean? Well, I've been reading Talmud all my life, and there are all of these places or these passages that I've never understood. And yet, when I'm using my medical cannabis, I get it. So I think it was a fascinating story that there was residue of THC found in, I believe, the Second Temple in the Negev Desert recently by a BBC film crew. So it's been around and people are using it, and you just wonder how much it brought to bear in, you know, the Bible and other ancient texts. Okay, let's move on to the next. So I'm just going to talk about this briefly, but I think it's really important to understand this is why cannabis works. We have an endocannabinoid system, and I'm sure people know about the serotonin system and the dopamine system, all these other neurotransmitting systems. The endocannabinoid system is actually the master system. It's connected to all of the other systems, which is why I think it helps in so many different issues, medical issues. And you can see here the things that I'm talking about that it's involved with. In fact, I just interestingly, again, I was at this uh, podcast last night, and there was a woman who her child at 5 months had to get a heart transplant. And she had learned that the University of South Carolina had done research using cannabis could really help prevent a transplant rejection. The kid is now 4 years old, is only on one anti-transplant med, and the rest of it is cannabis. I was blown away by that. And, you know, I think there's a lot more that needs to be looked into, but obviously it's working for her daughter. Okay, let's move on. I have to mention this because I think everybody is concerned and rightfully so. There are things that can happen. There could be untoward effects. People can get dizzy. There can be fall issues. Um, some people have adverse cognitive function from cannabis, but I'll talk to the other side of that in a minute. Um, but really, they're rare. I generally will tell pregnant women not to use it. There are other of my colleagues who say that they think it's fine. In terms of adolescents, I have a colleague who's using cannabis for autism and having amazing results. So in patients like that, I think I would say adolescents, you know, could certainly benefit from it. And the one other thing I will say is if there's a family history or a history of someone having psychosis, you really want to be very careful about giving them cannabis because it could lead to a psychotic break. And I think that's important to mention. Okay. You have the next one, Lauren? Okay. So I think this is an important thing to know also, in terms of dosing, and I'll talk about the various ways here of doing it, but you always want to start low and go slow. That's, with any medicine, you want to do that, but certainly with cannabis, people can be very sensitive to very low doses of it. So you always want to start at the lowest uh, concentration. You can go on to the next one. What I like about medical cannabis is that there are really three different ways that it can be used. Topically, I have a lot of patients who have chronic pain and they will use topical products they get from the dispensary, and it can be very, very helpful. And then we have the two other categories, which I like to categorize in terms of fast acting and slow acting. Things like vape, a joint, um, sprays, drops. Those are all products that will come on. I mean, the vape comes on within a minute or two. The others will come on in 15 or 20 minutes and last for a few hours. And I like to think of them as something for breakthrough symptoms. Um, I'll tell you a story. I have a patient who she works for the insurance companies to and has to go into repair shops to check on, how much the insurance company should be paying. And those are generally, according to her, pretty male dominated areas. And oftentimes they will give her a hard time and it'll bring on her migraines. And she has come up with a solution. If that is starting to happen and she feels it coming on, she'll go outside into the parking lot, do a couple of vapes, and in 5 minutes she's able to go back in. So, I mean, and this is one of the nicest things about having all of these patients, because I love the stories that they excuse me, that they tell me about how they have excuse me, taken cannabis in and really used it to to integrate it into their lives so they are as pain-free or as symptom-free as possible. Um, the other category are ones that you ingest, whether they be powders or gummies or tablets or capsules. Because they have to be digested, they can take an hour or so to come on, but they can last up to 6 or 8 hours. So people who have symptoms all day long, chronic pain being, the most common, will take a capsule, for example, in the morning, and they will oftentimes be good to go. Some patients need to take a second one, but again, they can just sort of figure that out as they get started. And then if somebody has an issue and they've been at work, they did some lifting, all of a sudden they have breakthrough pain, they can have the fast acting product to use and to just get the pain relief that they need. So I think that's sort of the way I look at it, and I tell people that they really need to try different things, take notes, because it is a medical program or product, so that if you are getting something that's 5 milligrams THC and 5 of CBD, it's going to be exactly that, and it's going to be consistent. So every time you take that product, you'll have the same benefits. And I think taking notes for that reason can be very helpful. Okay, let's move on. Sorry, it's slow. I think, oh, okay. Okay, here we go. So as I mentioned earlier, the elderly are the largest demographic using cannabis these days. And as we know, I mean, this is just a list of some of the chronic conditions that the elderly have. Um, and there are various medications for them, but I think what's nice about cannabis is that it can help a lot of these different conditions. Um, and so I'm really excited when I see elderly patients because I know that we're going to be able to make it work. We'll be very careful. We don't want to have any falls or anything like that. But if we're very careful and we work with a good pharmacist, that's, that I think we generally will have, I'd say 80% at least of patients have success. And which brings me to another thing that what I really like about the medical program. Patients who are certified by me, before they can get any product, they have to speak with a pharmacist at the dispensary. And I think New York is one of maybe 3 states with medical cannabis that requires that. But I think it's really, really helpful. I think it's very reassuring to my patients. And I work with these pharmacists all the time. I'll talk a little bit more about dementia, and we are seeing patients, and you really want to stay on top of it. The families are often very concerned and they want results, and we gradually go up, but I'm working with a pharmacist all the time who really knows what she's doing, and we have really a collaborative effort, which I really like. Okay, we can move on. Right. So as I keep alluding to, chronic pain is one the most common, and also interestingly, the one condition for which there are, I don't know if I'd say a preponderance, but a lot of studies showing that cannabis can be very helpful for chronic pain. And again, here we're talking about musculoskeletal or neuropathic. It can really help both those types of pain. Again, because it's that anti-inflammatory effect and the pain relieving effect can be really, really helpful. Okay, next. And I should say also that sleep being one of the issues, it's interesting because um, some people use a high CBD product because it calms them down to sleep at night, and other people use a higher THC, an indica. I don't know if we need to talk about sativa and indica, but I'm certainly help you to to answer questions about it. But anyway, people are using an indica to go to sleep at night as well, and it really is helpful. So I'll just talk a little bit about cannabis and dementia. I'm seeing a number of patients with dementia who really do very well with cannabis. In fact, we're trying to do a study with Northwell and Caring Kind, and we just got plugged into a company that actually has biomarkers that can be very helpful at determining whether or not somebody will respond and which combinations of THC and CBD they can use to help them respond. It's very exciting. It's really just taking off, but I think it's groundbreaking stuff. Okay, we can move on. Right. So again, I didn't want to really pay a lot of attention to this, but there really are symptomatic treatments and treatments for the neuropsychiatric symptoms. Um, and I have seen that Seroquel, Zoloft, um, all of those drugs, while they can calm people down, because as we know, aggression and anti-social behavior can really be a predominant kind of behavior in patients with dementia. But to me, just giving them antipsychotic tranks or benzodiazepines to just really puts them down and doesn't really allow them to interact. So cannabis, on the other hand, as we will show with the next slide, um, has a number of benefits. it can increase the levels of acetylcholinesterase, which is a major cognitive neurotransmitter, which goes down in patients with dementia. We can go on to the next. So again, CBD is really so helpful for all of these reasons that I'm talking about. And again, one of them is that I realized that people, as they're realizing that they or recognizing that they are developing dementia, get very anxious, understandably. I think any of us would. And that anxiety really pushes a lot of their behavior. They no longer have frontal lobe inhibitory pathways, so they act out. And we're giving many of them a high CBD ratio, so more CBD than THC, and finding that a lot of times they're much more interactive. They, in fact, some family members have said to me, my mother or father is actually remembering things that he hadn't for a while. And I think, again, any of us, anxiety can prevent us from accessing information. So it's nice to see that anxiolytic effect of cannabis really do that. And let's move on. And again, I'm just alluding to all of these things, but I'm happy to talk in more depth um, about all of these different properties that cannabis has in the various disease states that we're seeing. I just wanted to mention this one Israeli study that came out 2 years ago. And Israel is doing great stuff with cannabis. Um, but this was interesting because this really helped people, and as much as it helped the patients, it helped the caregivers as well. That muscle spasticity that patients have, they would loosen up. And caregivers are having difficulty moving patients. They're spastic. They're all tied up. Cannabis can really help with that. So as much as anything, this study really showed that as helpful as it was for the patients, it was also equally helpful to the caregivers. And I think that that's great because that's really an important component of the care that they're getting. And then I think we have one more. Yeah, I'm just going to do this one quickly, but this is a patient I've now been seeing for over a year. She was very anxious and was drinking 2 bottles of wine a day. And within a day or two of us putting her on a 1-to-1 capsule, excuse me, her anxiety greatly diminished. I just saw her to recertify her a week or two ago. She was not anxious. She may have a glass of wine at dinner, and that's it. And this is, I mean, these kinds of things are so gratifying and exciting, and show me or tell me that there's really a lot we could be doing with our elderly patients in so many ways. Okay, I think we have one more. Yeah, and these are all the things I see. And again, it's this point in my life and career to have this with my patients. It's really, really gratifying. So I hope that everybody who's on this will think about this and think about situations where they have patients or family members or whatever who might well benefit from this. And, please let us know. Please contact us. We're happy to get to certify these patients. And I think that's it. Right, Lauren? Yes.
So thank you, Dr. Weinberg. I encourage our viewers to put any questions or comments they might have in the chat. And Lauren, I was talking with Dr. Weinberg earlier when you stepped out for a minute that he's got a blog. Maybe we can put the blog address into the chat. So I do have a question. Hopefully we'll wait and see if anybody has any other questions. Is there any pushback, Dr. Weinberg, from the facilities where you treat some of your patients in terms of marijuana treatment?
Great question. And I'll tell you something. You guys know, do you work with Care in Kind at all?
I don't specifically, but we have a whole section which you can see behind me, a Circle of Care, which does work with caregivers for dementia patients, so they may.
The reason I ask is because I have been working with them and have met people, for example, at Coterie and other high-end senior living facilities, and they say, "Oh, we're so excited! We just did we just made basically an approach to how we can integrate cannabis into our patients' lives, and then nothing happens." And it seems that there is, in terms of pushback, I think a lot of these places, while they may understand that it could be really helpful, I think the liability issue is holding them back. And in fact, I was at this conference or this podcast last night with Dave Holland, who's a cannabis doctor. He's been cannabis attorney, excuse me, who's been very involved with NORML. And we are going to now tackle this issue because I feel really badly, as I said, when I see this and see how well people do, I I would love to get this to other people. The main place that I'm seeing patients is at Inspire, on Second Avenue between 93rd and 94th, because they are very open to it. And we've been doing it for 2 years with them. But I've seen a couple of patients at the Bristol, but it's been a little more surreptitious, and it's unfortunate. But I think if we can address what seems to be the major issue of liability, I think we may be able to get in there.
Right, and when you say liability in terms of potentially adverse results from the treatment.
Right, a fall, tachycardia, psychosis. I mean, definitely things that potentially could happen. I mean, again, we're using the lowest doses, especially in the elderly. So the likelihood of something untoward happening is very, very unlikely, but I understand that, So yeah, I'm hoping that we can, tackle this problem.
Okay, I see Lauren has posted a question here. How do I talk to my doctor about getting on medical cannabis?
Yeah, which is a great question, Lauren, because there is still a lot of resistance in the medical community. I think maybe 10% of all medical schools teach about the endocannabinoid system. So it's not surprising that my colleagues would be reticent to get their patients enrolled. But I've had this situation a number of times, and I make myself available to the doctors. I think it's really important to be collegial and to talk to them and say, this is what I think could work. In fact, I'm seeing a patient at Inspire. She was at the highest dose of Seroquel. Her psychiatrist, who's a very qualified guy, was like, "Hey, what are we going to do?" And somebody suggested cannabis. And he knew nothing about it. We had a really great conversation. We now have this ongoing dialogue, which I love. And the patient is doing better on cannabis.
Well,
So I think really having the dialogue with the doctors if they're, or other practitioners, if they're open to it, is the key.
It sounds like you would probably agree that the medicinal use of cannabis is in the early stages of research. I'm wondering if there's anything in your experience that kind of is a parallel to what's happening now with cannabis?
You mean other drugs that,
Yeah, or something that sort of came out of, I don't know, want to say left field, but sort of came up and suddenly started creating some noise and getting some attention.
well, certainly psychedelics and things like ketamine, because I think they were there in the 50s, and then they went underground. Again, LSD was also put as onto a Schedule One listing.
Right.
And now there's a lot more work being done. So I think that's a good parallel.
Okay. Very good. And I see some more questions from Lauren here. Uh, how long does it take to figure out the right dose?
Again, a great question. We have that one example of that patient who, within a day was great. That's very unusual. Oftentimes it can take days or weeks to really figure it out. But I tell people that they really need to take notes and they need to pay attention and they need to not be discouraged, and they'll ultimately find a sweet spot. And the vast majority of them do.
Okay.
And they're working with us and with the pharmacist as well. We always are available for follow-up, especially as somebody's just getting started.
Okay, very good. We have a question here from Wanda Jackson, who says they have their first appointment next month, and is there any advice for them in terms of questions they should ask?
Appointment to get medical cannabis?
I assume that's what's implied there. Yeah.
No, you know, without patting myself on the back, I think if you go to our website, there is a vast amount of information that we've put there, um, just for this reason. And I mean, you can certainly go online and look at things, but I think Cannabis Doctors of New York has a lot of really good, relevant information about cannabis and how to approach it. So that would be what I would say.
Okay. She appreciates that. Another question, is there any advice for reaching family members who still think there is a stigma related to cannabis use
How does one approach those patients?
or family members?
Yeah, family members. It's hard because, I mean, if like that film that I showed, Reefer Madness, think about that. It was in the 1930s, and yet it still resonates with people. I'd say certainly to have them contact someone like me, or um, they could talk to the Office of Cannabis Management perhaps. But, we're happy, Lauren as well, to talk to people about it. We actually have a nurse, Sarah Hallwile, who sees patients, who's very knowledgeable and happy to talk to people and try to disabuse them of those negative feelings. So I think that's what I would say. Oh, it's hard. I mean, those things really fall away. It's very difficult.
Okay, very good. Here's a question that Lauren posted that I had too. Are insurance companies reimbursing for this?
No, we can submit a super bill, which patients can then give to their insurance companies. But again, last night, one of the people on this podcast is an attorney, Jeff Hoffman, who's very involved with the cannabis space, and he said that there's a bill that's going through the legislature right now to allow payment in New York State for this. So stay tuned, but that would be great.
Someone asked where they can get more information. Lauren did post the link to your website so people can look at that. Here's another question. How do I store cannabis products?
In a cool, dry, dark place.
Would the refrigerator work?
You could put it in the refrigerator. I don't think you need to be that excessive, but if there's just a cool place in the house, um, I don't think there's any problem with refrigerating it, honestly.
Okay. Here's another question. What can you do if you take too many products at once because you didn't think it was working and then you find yourself getting high, maybe too high? Is there a way to get less high?
Yeah, well, the overwhelming thing I would say is that it's going to go away. And I think you need to know that. Edibles are a huge issue with that. Because you'll take something and in an hour you may not feel anything, and then you take another one, and then all of a sudden you're off to the races. CBD actually can counteract the effects of THC.
Hmm. Did not know that. I haven't heard that. Well, you're mentioning the problem with edibles that people maybe eat too much because they're not feeling anything, and then it sort of hits them from behind. Uh, would you recommend the use of edibles vis-a-vis other types of getting the drug?
Oh, absolutely. Yes, because anyone who has a chronic issue that they're having, for example, pain all day long, having an edible, once you figure out what dose works for you and you take that edible in the morning, you can be good throughout the day.
Okay.
So I think you have to be careful, obviously, but once you've figured out what dose works for you, no, I think for people who have chronic issues, the edibles should be the mainstay of treatment. And then you can use for breakthrough symptoms, one of the fast acting products.
Okay. So I have a couple questions about talk about the older population now. Are most of these people, you know, people who used marijuana when they were in their teens or 20s and now are coming back to it, or maybe they never left, or is this a new population?
It's both. It's both. The articles I've read, there are certainly people who've been around and using it forever, but then there is a significant part of that population that has never used it and have learned, oh, my father, my brother, whoever, is using it and it really works, and then they start using it.
Okay. All right, so there is an audience out there for it. And what do you say to people who have used it in the past, maybe when they were much younger, and they have certain ideas about what it's like? Is there something different now in the physiology as an older adult, or just your approach to it, perhaps?
To me, the main issue is that in New York State, it's a medical program and it's really precise. And you go in and start with something at a very low dose, you can very much fine tune the benefits and the side effects. I mean, so yeah, certainly weed that is growing, that commercial or recreational, has a much higher THC product content than when we were all growing up. So that's an issue. But the medical products don't, so you can really precisely. What's that?
Uh, Lauren, when maybe went off mute accidentally.
Oh,
Um, But now you are also, you're talking about you're not talking about like in New York, because right now there's places all over the place that presume are not clinical. They're just somebody opened a store and selling marijuana products.
yes, and the state has been sort of overwhelmed and not doing a great job at closing them down because you have no idea what you're getting when you go into these places.
Right, right.
Also, if I could just chime in here for a second, I work with Dr. Weinberg, everybody, hello. What the New York State is doing to try to help this issue is there will be a QR code on the window licensed dispensaries. And so that's something that consumers can see and actually scan with their cell phone to verify that this is a dispensary that is selling products that have been regulated by the state and have been tested to be safe for the consumer. So that is something that they are doing to try to combat the rise of these other illicit shops.
Yeah, no, thank you, Lauren. That's great.
Yeah, it's good to know, because I think sometimes for the average person or consumer, they're not really that clear about what's the difference. So it's good to get this kind of information from you, Dr. Weinberg, to let people know that there really is a distinct difference, and if they want to go the medical route, there are steps they can take, not least of which is, of course, listening to this presentation. But I see Lauren's posted some other information that people can access, a YouTube channel, as well as a website. So we certainly encourage everybody to check that out. That looks about all the questions we have. Is there any other thoughts or comments you want to make, Lauren?
I think just one more thing. So, something that these consumers have the right to ask for any products that we purchase when it comes to the medical cannabis route, or even if you're doing over-the-counter cannabis, is called a certificate of analysis. And that's what a company they'll pay for a lab to test those products to ensure that they are, again, safe for human consumption. So no pesticides, no harmful chemicals. So that's something that you can always contact a company that you're interested in purchasing from to sort of do your own due diligence.
And they also will tell you what cannabinoids, what terpenes. I mean, they'll tell you what products are in there, legitimate products, and hopefully what illegitimate products are not in there.
Okay, very good. So there's some concrete steps people can take to ensure they're going down the right path. Well, thank you again, Dr. Weinberg. Thank you, Lauren, for your help. We really appreciate it. It's been very informative. I have a feeling that this is going to be a bigger part of the universe for older adults. And we look forward to hearing what else comes out of your research, Dr. Weinberg, and your treatments. Thank you very much.
Thank you. I'm always happy to.
Before you go, Dr. Weinberg, I just want to say this is Kirsten. I'm actually a patient of Dr. Weinberg's. He is excellent. To the point, if you want to look anything up regarding medical marijuana, go on Leafly. There's an app and there's a website called Leafly that's very informative as well. And it'll also let you know where the medical dispensaries are so you don't have to be mistaken in a recreational one, just to the last point.
Okay. Is Leafly just for marijuana or is it for any kind of plant?
It's for marijuana.
Okay.
Yeah.
Okay. All right, very good.
Yeah.
Plenty of information here. Thank you again, everybody. We appreciate it. Thank you for all our attendees, and please continue to look at the PSS events page for upcoming events.
All right. Be well.
Take care.
Okay.